Hey guys, how's everybody's Wednesday going? Just seeing if you guys can hear and see my starting screen. Howdy, howdy. Hey, Go-Kart. Hey, Nancy. Hey, Marcy. Hey, Ray. Hello, Crystal. Hey, Casey. Hello, Hannah. Let's see. I'm getting ready to take my CPC exam. Is there any tips or good notes to write my books? I'm struggling figuring out what is on or what to study. Thank you, guys. Thank you for letting me know y'all can see and y'all can hear. I am going to go over what you should study from every chapter of the exam. So there's 17 sections on the CPC exam that you should study and know about. I'm going to go over that next Sunday, the 20th. So if you want to participate, it's a $12 workshop. It's 3 hours. We're going to do 75 questions in 3 hours. About 3 questions from every section, those 17 sections, so that you can get a feel for what you need to study out of each section. So that'll be a really good workshop. If you haven't booked it, you can book that at medicalcodingbyjen.com. And other than that, if you've got the practice exam questions from AAPC, those are a really good mini exams broken up into 50 questions each based off most of the sections that they cover. Renee passed her exam. Oh, you awesome. No. You're the awesome one. You took that exam and passed it. Congratulations. That's awesome. Thank you so much for coming back to let me know. Yay. It's fantastic. Kathy's been watching my duck classes since 7 p.m. and now it's 9:30 in Florida. Awesome. I hope they're super helpful. My duck classes are on Fridays. They're $5. We do 2 hours. So we try to do 50 questions in 2 hours. But I do more teaching in those. So it's hard to get to all 50. But we work on more complicated questions, ones that have tricky areas. How's it going, Sandy? Good to see you. Hey, Crystal, your exam is in 10 days. Oh, boy. Hey, Kathy. Hey, Miggy. Good to see you. Hey, Sam. Hello, April. Hey, Patrice. Good to see you. My Texas girl. Hey, Ramon. Howdy, howdy. That's perfectly fine, Crystal. No worries. Crystal's is on the 26th. Hold on, I got a cat. Wanting in or out. You want back in? Come on in, but you can't bother me. You got to stay down on the floor, not up on my desk. She's been up here helping me on my desk all day long. You got this. Hers is on the 6th. Ibis, hers is on the 19th. That's awesome. That's the day before my workshop. Goodness. Yours is on the 19th. Hey, Diana. Good to see you. You take your CCA tomorrow morning. You are very welcome for your help, Melissa. I've got Bro on TikTok who said I helped her pass her CPC in April, and she just started a new career this week. Thank you very much. Oh, that's awesome. Thank you so much for coming in to let me know. That's fantastic. just to know that I made a little difference in your life and it's getting better. That's my whole goal here. Whether you purchased anything or not, it makes me no difference. It's just the fact that I could have made a difference, made this exam less stressful for you, and you were able to pass. That's fantastic. That's great. It's perfect. Yours is on September 12th. Third time. Alicia. Awesome. Hey, Crystal. I told my teacher about you, and so she's just going to start telling her students to watch you. Aw, thank you, Crystal. I hope I can help her out and help her students. Hey, Andrea, good to see you. Love the emoji thingy. Hey, Nicole, your exam is on October 7th. Awesome. I think we had Dev who took hers recently. I wonder how she did. Haven't seen her back a little bit. I was wondering, curious. I hope the recent videos have been helping. I did some on radiology. I did one on OB codes, one on dialysis codes. Super helpful. I think, I hope anyway. Just shorter videos, 3 to 4 minutes long, that just go over one section. A little bit more helpful. She likes finding people on YouTube, and she can start telling her students about. Awesome. I was asked, somebody found my stuff on YouTube too and asked me to write an article for them. So I'm working on that. I'll let you know if it gets published. Aurora, I'm studying for my exam, super nervous. Any advice you have? You do watch my videos on YouTube. Yep. Lots of advice. Be sure and watch my practice questions that we're going to be doing tonight. I usually pick them for a reason. There's something in there that's pretty current with information that will help out with the certifications exams. Whether you're doing a HEMA, NHA, or CPC, I scour the Facebook and social medias for people that recently took it and see if there's any tips or information that they leak out to let us know what kind of areas they're seeing on their exam, just to help out. I try to gather that information and base my questions off of that, so that's super helpful. I've been down in the dumps since. There are so many questions I've never seen, and I used my 2022 books. Don't worry about using the 2022 books. They're perfectly fine for the exam as long as you fix your E&M section and your digestive system. You need to go through those two sections and update them. The digestion system is just the ending where you delete all the old hernia repair codes and you add in the new hernia repair codes. And I have a document on my website at Medical Coding by Jen. It's like $20. It will turn your entire book, if you want to go through and do the whole thing, into a 2023 book. If you have a 2022 book, it's a picture of exactly what I changed in the 2022 book, and then a picture of what the 2023 book looks like so that you can see the differences. It doesn't include my notes, but at least you get all the new updates in the ICD or in the E&M section, which codes to delete, which times to change, because a lot of the times changed on the office visit notes, and stuff like that. We deleted like 10 pages of codes in the E&M section. So if you just update those two sections, you'll be able to pass the exam. Crystal got a 69 and she failed because of the 6,000 codes. Be sure and pay attention to your parenthetical notes in the 6,000 codes. It gets kind of crazy with the mother code will get a modifier, but then the child code only gets the timeses. So just keep in mind what the parentheticals say in the 6,000s. That's super important. Sam, if you've already been a member of AAPC, it sounds like you are. If you've already been trying for the exam, you've already sat for the exam and you just didn't pass, and then now you need to try again and get an updated book, try for a scholarship at AAPC. Let them know anything that you're personally dealing with, health-wise, family-wise, anything at all. Anything. If you have, if you're hard of hearing, have visual impairments, have family member stress, financial issues, anything. Let them know all of that. I just posted the link in the chat on YouTube. I can't post it in TikTok, guys. I'm sorry. But there's a link there. If you've attempted and been a member of AAPC for a year, you can fill out this grant information. You can get them to pay for your next year's membership, which is like $300. You can have them buy 2 more attempts for you, which is what, $400, and then also ask them for updated books and whatever that cost. And keep applying monthly. Be sure if they do deny you, be sure and attend your next chapter meeting next month, whether you do it virtually or in person. Let them know who you are, because they're the ones that pick the winners. So if you introduce yourself to your chapter meeting president and whatever, and put a face with this application when you apply the next month, maybe they'll pick you next time. But they have millions of dollars for the scholarship. So please, do that. And Pocket Prep has a scholarship too. Yes. Is that go-kart? She is completely correct. Let me post that in here too. I've got the link for that. If you want 500 questions for the AAPC exam and you want to get access for the next 3 months to those 500 questions, you can also apply at Pocket Prep. They will give you access for those, so try for that too. There's the link. Pocket Prep's pretty reasonable. It's $34 for 500 questions for 3 months. If you do purchase that plan and you don't pass within 3 months, they do have a pass guarantee where they will give you another 3 months for free. If you buy it from month to month at $14, that doesn't come with the pass guarantee. Renee just gifted someone a free YouTube membership to my membership, where you get exclusive access to my old workshops. Thank you so much, Renee. She just gave it to Sam, so that's fantastic. Oh, that's awesome. Thank you, guys. Here we go. Got the cheering going on. Congratulations. Is there a video on how to convert the 2022 into the 2023? No, I did not make a video for that this year. Didn't even think about that being a possibility. I probably will do that from the 2023 to the 2024, but I did not think to do that. I do have, of course, I can post the link to the item that you can purchase out of my shop that will help you convert your thing. Yep. Let's see. That's for ICD-10. Where's my CPT collection? That's not working. Nope, that's not it either. Let's see. Gonna be after all that. be in the middle of all of this. You know what? I wonder why that button doesn't do anything. Shop now. There it is. Let's repeat workshops. All right. And we get that into there. Just get started on things and then forget to record it all. You're also in the Discord group. I can tell you if I don't pass this time, I don't know what's wrong. Oh, there's nothing wrong with you at all. It's that exam. And you know, they use psychologists to work with the writers who write the questions, who are trying to write them in a misleading way that most people would pick a particular answer if you read the questions from beginning to end. So yeah, it's not you. Which practice exams do you recommend to buy? I think D is one of the more difficult ones. D, E, F. I think those are more tricky than the other ones. If you have not passed and you've already failed your exam, you do have access to more additional questions. If you didn't know, they're called area of study questions. It's $14 for 10 questions, and you can buy from all 17 sections of the book, which equals up to a whole lot of money, almost $500 if you buy all 17 sections of 10 questions extra, but those are awful tricky too. So if it's only the 6,000s that you didn't pass, you could buy those for $14.95 from AAPC, and it's 10 questions just from the 6,000 sections. And you could buy exam A and exam B, where you get 20 questions from the 6,000 section, and those questions are pretty tricky and they're super helpful, so that might help. How much longer can we use the 2022 book? If you are doing any AAPC certification, you can use it till December 31st, 2023. So as of January 1st, 2024, you can no longer use the 2022 book. We can use the 2023 book all the way until January 1st, 2025. All right. Let's get started with the questions that I have prepped, unless anybody else has any more questions. Thank you to the people that have upgraded their membership subscription to the highest tier and have access to the book prep videos. I appreciate your support for the channel and working with all these questions. I had a lot of people wanting me to do cardiology caths, integumentary flaps, muscles, vaccines. I've tried to incorporate a lot of those in our questions for today. So remember, don't look at the question. If you're already reading the question, you're doing it wrong. We're going to focus only up here on the answers. We have a difference between the 206s and the 208s. Let's go look up the differences between those two CPT codes first, And then we're only going to search through our question to see which of those differences is in that question. That is the best and most efficient way to tackle these exam questions. If you're reading it from beginning to end, I personally think you're doing it wrong and you're going to get confused. All right. One of these codes is one of those codes I saw recently reported by people, so please be vigilant in these CPT codes and learning all you can about them. If I'm presenting them, there's a reason why I'm presenting them, so please be sure and make note of the ones that I present, and make sure on your own to go find as many practice questions that you can with these. There are extra practice questions in Quizlet and stuff like that online. So, our differences between these two CPT codes, does anybody know? What is your one-word difference between the 33208 and 33206? Anybody know? Even if you're on TikTok or on YouTube? You did 150 questions with the process of elimination with exam questions from D, E, and F, so that's 150 in 1.5 hours? Oof, that is fast. Good gracious. Oh no, Heather. Heather, have you seen my video about how to get through the CPC self-study course fast so that you could finish the whole course in one night if you wanted to and save what you need to save out of it just to get done with it, and then save the most valuable information for your studying for this certification exam? That's a really good video to watch. It's free to everybody. Heather, I think she's got it right. Yep. Andrea has it right. Yep. So our 206 is atrial, and our 208 is atrial and ventricular. So we're just going to check our question, and we're only looking for the words atrial and ventricular. And you see it right here, those last two words right there. So you know right away we're only going to keep C and D, right? And then using our common sense, right, and our rules that we know about our guidelines, would we do a symptom with a diagnosis, or would we just do a diagnosis? We know that anything that starts with an R in our ICD-10 book is a symptom, and anything that starts with an I is that circulatory? I always forget what the chapter names are. Let's see. A, B, C, D, E, F. I is diseases of the circulatory system, so perfect. And then R, of course, is symptoms and signs of abnormalities in laboratory findings not elsewhere classified, stuff like that, signs and symptoms. So knowing that our guideline says that we don't do a symptom when we have a main diagnosis without looking at anything else in our chart or our question, we would pick C and move on to our next question. This way you don't get confused on electrode placements. You don't get confused on anything that might be in here. Who knows what's all up in here that could be confusing you. They, of course, start off with shortness of breath and chest pain, which are just symptoms, but our ending diagnosis is right here. You should be able to get through with these questions 30 seconds if you just have to look up the difference between two CPT codes. Hopefully you've already got your books prepped where you know the difference in those CPT codes. And then you just look for that little bit of difference in your question from the bottom up. Super helpful. If it's E&M, we don't do the process of elimination, but this one we didn't do the process of elimination anyway. All we did was go look up the two differences between the two codes. So that's handy dandy. How many muscles does each eye have to direct vision? Is it 2, 4, 5, 6? What do you guys think? Eva has a job interview on Friday. Best of luck. Best of luck. Good question about how do you upgrade your subscription. I wished I knew. They changed it to where there's 3 levels now. The second level is to listen to the podcast, and the third level is to listen to or see the book prep videos. I haven't gotten in there to dig around yet and figure out how to do much with it. Maybe somebody else that has upgraded could type in chat and let us know. Perfect Maisie. How many muscles do we have in the eye? 5, 6, 4, or 2? We have 6 muscles that all work in tandem. You can find that in your ICD-10 or your CPT book, actually. Either one. What are the 3 parts in the ear? Are we going to go? We have some. I was trying to think of the, they have those things that you can say to yourself that have nothing to do with the subject, but they're mantras that you say to help you remember stuff in order. And I was trying to remember what this one was. We have 2 that start off with P, if you're looking for similarities, but we also have 2 that end in stapes and 2 that end in the C word. 2 that have incas in the middle, 2 that have this in the middle. Lots of similarities everywhere. Acronyms. I don't know. Do they call it acronyms? They call it a phrase. Gosh. I posted a bunch of them in anatomy in our Discord group. Me and Betty and Twinkle used to post these in our Discord group under the anatomy section quite often. Where is my anatomy? Don't forget, my Discord group is super helpful. If you have any questions that I can't get to on email or whatever, you can always post stuff in here. Somebody's always in here to help you out. There are practice question rooms. There's case rooms. CCS has their own practice room. This anatomy room. Oh, yeah. My anatomy room is bound to have those crazy phrases in it. What are those things? They're like, Sally Sue is slippery. And then you can remember SIS means something. They're little fun phrases that you can say or memorize. And I know there's one for this inner part of the ear, but I forget the name that we call them. Ooh, all the anatomy terms I have in here. I'm sorry, I'm looking at the Discord group. Inside here. Oh my gosh, there's so many. Layers of the meninges. Yeah, yep. Types of seizures. What types of seizures are there? Yep. There's 3 types. I know we posted a bunch of them in there. There's 2 years worth of stuff in here. You just have to scroll backwards till you find stuff. You can also do a word search. How many nerves are there? Yep. And get lost in these because they're such good information. What are those things? Yeah, there you go. MNEM. No, I didn't label it that way. That would have been nice if I used the proper term for it. But yes, you are right about this one, Renee. It is the MIS. Mary is slippery. Our tympanic membrane vibrates like a telegraph, and it sends messages to the middle ear where the other part of the ear picks up the vibrations and transfers it to the incus and the stapes. And these 3 tiny bones are all called the O word, and they are carrying messages through those oval little windows. Super cool when you look at the inside of the ear with this, when you're reading this, all that stuff that's going on. It's pretty amazing. Even having your external ear, the shape and size of it definitely matters. You don't want small, little, tiny ears if you want good hearing. What's another word for sclerocorneal junction? Is it cornea, tear duct, limbus, or pupil? The eyes are my worst subject, besides allergy injections. Oof. Can you use me as reference? Absolutely. Let's see. Where is my... Oof. My cats. Do I have it up here on my website? I may not. Really? I don't have it up here? I'm not very good about boasting who I am and what I do, but if you go under social media on my website, the social media links, you'll see my address, mailing address and stuff that you can put on the resume. You can say you studied under or with me. That may help out. I thought I had my bio on the homepage, but of course my internet is acting crazy. Come on. Let me see if I can find it another way. Let's see. Oops. Pictures. Let's see. It's not there, of course. So, y'all know that I'm a quality program specialist, data analyst, and auditor, and the winner of the Bassinger Award in California twice for quality improvement for my medical group. Let's see if I can spell this for you. Let's see. There you go. I've won that twice. They only give that award out to one medical group every year for the entire state of California, and it's a pretty big state. And I've won it twice since I became an auditor, which 2010. Yeah. So that's pretty cool. I think, anyway. All right, this question. Limbus. Did anybody get this one right? There's 3 different memberships on YouTube. First membership gets you the access to the repeat workshops if they're 90 days old, and exclusive videos that I make you guys when you ask on the YouTube channel. And then the second tier is for the podcast. Third tier is for the book prep videos. Howdy, howdy, Twinkie. So if you go to the ICD-10 book, right before you start diagnosing any eye issues, there's going to be a whole disease of the eye chapter, and it's going to go in how do you make the eyeball on a cellular level. It's going to tell you all about the parts, and then it'll switch over to the diseases of the eye and stuff. That's where you will be able to find this particular issue. Where the cornea meets the sclera, there's a ring called the limbus. It's also known as the sclerocorneal junction. Physicians often will reference the limbus when describing the site incision during eye surgery. That's where they're cutting. They may just even say junction. This is just a word match. So we've got 4 nerves here. 1, 2, 3, and 4. I forgot to put the numbers down. Which one of these is a facial nerve? Is it the sense of smell? Does it control movement of the eyeball? What about responsible for chewing? Or controls the facial muscles of the eyes, forehead, and ear and mouth? What do you think? Oh, I don't know what I'm looking for, Twinkle. I'm just roaming around like crazy. Where are our diseases of the eye? In the ICD-10 book. That's kidney. Chronic ulcers, that's gout. Trunk, liver, pneumonia, that's lung. It's cardiovascular, circulatory system, ears. Diseases of the eyes are the H's. So yeah, right before the eye. I'm in the 2023 ICD-10 book. I'm on page 603, but it's AAPC's version. It is going to be mixed in here. Gosh, I need a word find. Y'all are saying B is number 1, C, B, C, D, A, and then that's Kathy. Marilyn says D, C, B, A. Kathy's changed her mind. Yep, I just put them in opposite order. D, C, B, and then A. Olaf with his carrot nose. Yep, all I did was just flip them around just a tiny bit. All right, don't read the question. Don't be tempted. You guys know we're going to go see what our differences are in these codes. We've got 2 of them that are in the 970 and then 2 of them that are in the 971. There might be a header difference. Let's go check that out. 970. What is our one word difference between the 970s and the 971s? let's see, they're under physical therapy, physical medicine and rehabilitation. Yeah. Our 970s are under modalities, and our 971s are under, this one's under occupational therapy. What's our 139? It's underneath a therapeutic procedure. These suckers are all over the place. And 70, 35. We've got over under constant attendance, and our O10 is under supervised. So let's check it out. Sammy, don't you dare. No. Be good or you're getting booted. Sorry, my cats. We're going to look from the bottom up. We're doing outpatient physical therapy. We're doing one-on-one. What do you guys think? If you're in the 2023 book, it comes after the 971s. Keep going. The 170s come after the 171s. It's very confusing. All of them are, even though it's the ones that are out of sequence push the ones that aren't pushed out of, that aren't labeled as out of sequence, end up being out of sequence because the out of sequence ones push them out. I don't know. Does that make any sense? But just keep going. Keep going. They come after. It's a nightmare. Travis is being so quiet. No telling what he's doing out there. Are we going to keep the 970s or the 971s? We're doing physical therapy. Occupational therapy. Yep, I get rid of A and D, and then our differences are whether we're constant with the patient or we're just supervising, right? And we're one-on-one, we're in constant attendance. I like B too. Good job. Let's see. Yep. We did 30 minutes, so it's times 2 for 15. Perfect. All right. Don't look at the question yet. All these codes are going to be right in a row. So all we're going to do is go look up our differences. 97165. This is low. Our 66 is moderate. Our 67 is high. And our 68 is a reeval. We're just going to check our question from the bottom up to see which one we would be. $67 identifies 5 deficits, which is helpful to know. B, which is 66, does 3 to 5, and our low does 1 to 3. So we identified 3. So we have 2 that it's possible in. We could do 1 to 3, or we could do 3 to 5. Doesn't say anything about being a reeval. What do you do in this situation when both answers have that in it? How are you going to decide?
Jay's Bruckman has become a member.
Yay! Thank you for subscribing too to YouTube. I hope those bonus videos help out a whole bunch. She figured it out to upgrade. Awesome. Where did I find the OT evaluation subsection? So, let's see. Anytime I start on a code that may be here, I always look backwards and wait and see if I can find a header. And our header right here was occupational therapy. So I found that header. And then we've got another one where these are for physical therapy. So these codes are for physical, and then these codes coming after are for occupational. Now the ones we're looking at right now for our deficits are 3 to 5 or 1 to 3. Anne is correct. We're going to code lower. Also, it says that there was just a brief history and assessment. So it says the assessment was brief. If you look at 65, inside the first bullet point, it says that the history, which includes a brief history, is included in that one. If we look at 66 in its first bulletin point, it says that they had an expanded review of the history. So they actually have different words. This one's brief, and then this one would have been expanded. But if ever in doubt, always code low. Does everybody see where that's located in the book? Yep, it is the vape. Good job, Shawnee. That's perfect. So we're going to pick A, I believe, on this one. Yep. Perfect. If a patient is brought to the ER due to an accident at work to determine a specific drug and the quantity in the patient's system, is the test performed presumptive or definitive? So Amazon worker gets in a car accident. What's the first thing they're going to do? They're not going to worry about patching their bones up yet or sewing any injuries up first. What they're going to worry about is collecting that drug screen to see if the employee was impaired or not first before they decide whether they're going to pay for any medical injuries. Would we be doing presumptive or definitive? That'll help get you down to a 50-50 shot. Then we can worry about the rest of these sentences. Yep. Definitive, we need to know if they definitely have it in there or not. So we can get rid of A and B. And then definitive determines the presence or absence of a drug only, or definitive identifies specific drugs and associates the metabolities. And you remember in these wordy ones, I try to stay away from the words that say only, always, that kind of stuff. I always try to get rid of, because nothing in medicine is always or only. There's always exceptions. So if I had no other idea about which answer was right, get rid of the one that says only or always, and you can usually come up with the correct answer. I did put down the definitions here. Mark these up a little bit better. Definitive testing may also be called qualitative, Q-U-A-L. I go through that entire lab and path section and mark every result that's qual in a particular color, so that I understand and can make differences between it being definitive or quantitative, the amount. And then I change the color for the quant. And I color code each one so that I know those differences. Super helpful. Quant is how much. All right. What I see when I see these answers, because I'm not looking at the test question at all, is I see a bunch of panels, right? The ones with the 2 zeros right here in the middle. I know that I'm in Lab and Path, and I'm in the panels. The panels are staring back at me, right? They're little smiley faces. Those are panels. And those are located in the front of the Lab and Path section. Sometimes they're hard to find if you're just trying to find the numbers. But remember that the OOs are always those panels in the front of our lab and pass section up here. And those are organ or disease-oriented panels. Remember that little term right there about these OO things. And just as many examples as you can find about how to go about ordering these, put them in your notes. Super helpful to do that, like I do my notes. So if we're looking at our differences, if we're looking for similarities, you know that B and C start off with the same answer. And a lot of times, many of the exam questions have answers like this. One answer is slightly different from the other one. They just want to know, do you know the differences between those two answers? And the other two are just throwaways. But if you're scared to do that, you can always look up your differences between all the codes. The 53 and the 51, our differences are, this is an electrolyte panel, and this one is a comprehensive panel. That's comprehensive. What did our doctor order? They ordered a sodium, potassium, chloride, carbon dioxide. What would we order? Yep, it's going to be our little A at the top. We don't even have to worry about our 53 and ordering this. This has 4 tests in it, 3 test CPT codes anyway, but we've got 1, 2, 3, 4. That's funny. We wouldn't order individual tests when we have a panel that includes all of them anyway. You can see on the 80051 that they actually individually list each one of these codes inside of it for you. So you do know the individual codes for it, but they bundle them all together in a panel, which is super nice. That way we're not filling up the claims with tons of codes. Here we've got some 992 codes and some 805 codes. What in the world? What's our 99242? That is a consultation code in the front. That's an E&M one, right? We've got a consult code for E&M, and then we have an 805 number, 805. Page 614. The 04 is a moderate. The 03 is a low. Straightforward, I guess. Really, they're not doing low, they're doing straightforward. And yep, our 04 is moderate. Moderate means they're doing 3 to 4 lab tests, and straightforward would be 1 to 2 lab tests. How many did we perform? That would help us out. We got bone marrow smears, multiple blood tests. Turn it off and down. You're not allowed to be on YouTube, and it's so loud. All right. Travis woke up. He got loud. What do you guys think with this one? 51 and D? D, 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 D? The MD asked for a consultation with a pathologist. Do we do E&M consultations with pathologist or radiologist? This would help you out during an exam. If a physician asks for a consultation on an MRA, MRI, a CT scan, whatever from a radiologist, they do not get a consultation from the E&M section. Neither does the lab and pathologist. So you know right away you can get rid of those. It has to be cardiologist, neurologist, pulmonologist, those kind of physicians, not pathologist and not a radiologist to get a 99 code. So that helps us out. Then we just need to decide if we're a 503 or a 504. It does say the word moderate in the question, so you really don't have to do much of counting or trying to figure out much of anything else. Just notice that word moderate and pick the one that's moderate. Yep. Lots of fancy stuff here. This patient is still an undiagnosed new problem with uncertain prognosis. That is a moderate, just based off its diagnosis. But also what you're dealing with is you're dealing with lots of medical records, multiple blood tests and bone smears. So we do have 2, but you add the old records on it too, we can get up to moderate with this one. All right, let's look up our differences between our 306 and our 307. These are always fun for people to find in the CPT book if you are struggling and haven't figured out where these codes are at. It can be a struggle, but you want to be sure and memorize where these 3 codes are because they will be on your exam. I can promise you that. And a lot of them are out of sequence and they're in different pages all over the book. It can be really stressful if you've not practiced trying to hunt these down, trying to find them. So the differences between our 306 and 307 are what? I'm not worried about the secondary code or the third codes, just the differences between the 8306 and the 8307. What's our differences? Does anybody know? Yeah, I recommend you go through the entire book and you write down the page numbers of where all the out-of-sequence codes are located in your book so that you can go find these super fast. I go through the entire book, and every red code has a page number and a column number where I can find the code so that I don't have to hunt these up. Because some of them just tell you to go look at some definitive drug testing subsection, and you don't even know where that is because it's not listed anywhere. Or they tell you that they're listed between 80 or 90 codes somewhere, and that's a nightmare too. You want to be able to find them quickly. So go through the entire CPT book and write down the page number next to each red code in the book. That way you can go find it quickly. These codes, if you are in the 2023 book, are on page 602. First column. Anybody know what your differences are on these? Thank you so much for the hearts and the likes. Almost have 1,000 likes and the 2 shares on TikTok. And the 17 subscribers on TikTok. What's our differences? Yep, one of them is going to be using a dipstick with a machine, and the other one is just a machine, no dipstick. We're just going to suck up the urine into the machine, and the machine will tell us the results. Or we're going to use a dipstick and then dip the dipstick into the machine, and the machine will tell us what colors the dipstick changes to. So we're just going to check our question for the word dipstick. Don't see the word dipstick used at all, so we're going to get rid of A and B. Then we just need to know if we're D or C. What's the number one rule that I told you about these codes to write down beside them? That is that we do not times these. No timeses. So if you see an answer with one of these 3 codes, either the 05, the 06, or 07, my notes say no timesing. You cannot times these. So that helps us get rid of C right away. Yep. No timesing. Yep. Super helpful to have that note in your books. You will see these codes on your exam, so please be sure you find as many practice questions as you can. Write down as many examples of answers that you have. Like I have a 80305 in my notes. It says it's a presumptive drug screen, dipstick, visual barbiturates, cocaine, methadone, and opiates used. So that word visual is super helpful. This TLC is the one word that you needed to know what that was for this question to work right. If you look on page 601 of your book, you've got an acronym conversion table where you can see that TLC means a thin layer chromatography machine, which just means that we used a machine to do the drug screening. That one little acronym made all the differences. in this particular question. Come on, voice, you can't go out yet. We've still got 45 minutes. If anybody's still awake, I know it's getting late on the East Coast, guys. We've got a couple of more panels looking back at us, right? I see some more smiley faces. And then we have some that are not panels. I can see that. If we were ordering a TSH and a T4, would we be doing a panel? Do we have a thyroid panel? Just thinking to myself, thinking about what I remember from our panels. Do we have a thyroid panel? Has anybody seen anything like that before? Just using your own memories sometimes helps. We should, but we don't. I don't think we have a panel that is a thyroid panel. Most of these are electrolytes, cholesterols, OBs, and kidneys. Liver, maybe, yeah. But there's no thyroid panel. So we can get rid of the A and B. And then how many tests were ordered? 2, right? So we ordered 2 here and we ordered 2 here. How many diagnoses? There's 1 diagnosis here and then there's 3 diagnoses here. We don't technically have a diagnosis with this one yet. How would we report weight loss, rapid heartbeat, and nervousness? Would we pick one and just code 1? We suspect that they're having hyperthyroidism, but we don't know for sure. Would we just pick one of them and code 1 since it's suspected, or would we code all 3 symptoms since we don't have a diagnosis? And even without opening a book here, you can do some of these questions if you don't stay so hyper-focused and think about some of them, because you know more than you think you do just by regular life and stuff. So you can do some without even opening a book. Yep, all symptoms, all symptoms. Yep. Perfect. Cool. Ooh, we hit 1,000 likes on TikTok. That's great. All right. We do have D as our answer because we do need all of our little symptoms. Easy peasy. Let's look at this one. We've got 2 of them that have the 52 in them. And then 1 is a symptom and 1 of them's in cancer. If you're chicken, we can go look up our differences between our 84, 152, 153, and 154. See what our differences are real quick. Thinking that we got time. 141. So our 52 is a PSA. They're all PSAs. One of them is direct. One of them is total. And then the 4 is free. Which one did we order? They ordered the total. So we know our answer is there are a lot of qualitative and quantitative on these pages. Be sure you mark all those differences. I use a purple for my qual and a green for my quant from my amount. Some of them are combo codes, like 83789 does both qual and quant, which is cool. Just to help you out some. So you guys agree with me? You think that B is our answer? It's again not one of our two A or D's. It ended up being our outlier. One of the outliers, I guess you'd say, is B for our total, right? Yep. Sometimes there's two. I was trying to figure out how to do this. Sometimes there is two codes for the same thing, like 80162 and 80163. One of them is total and one of them is free. A lot of times, the better one to do is the free, because it can, in real life, it can find certain proteins that are all in the body than the ones that is just a number, a total, instead of finding all of it. A lot of times, for these two, the digoxin total we do for heart failure, but the free we use for atrial fib, because we want to know how the medication is binding to the proteins in the blood and making it blood clotable. So we need to know how we're affecting the proteins in the blood. So this one, my notes has, it's for atrial fib. Oops, wrong set of fingers. AT. And then this one is for our heart failure. There's quite a few little ones that are like this in the book, like the 801, 85, and 86. Those two are a total and free. I've done the painstaking work of updating exactly what's being tested into each one of those throughout the lab and path. If anybody's interested, it's in my notes. But would you need to know this for the particular CPC exam? I don't think so. Maybe one like this if you're doing COC, but I don't think that they would. Maybe just this one, probably the 80162 and the 80163 if you're doing COC certification, but definitely not for CPC or CCA. They won't be getting down that nitty-gritty for lab and path, but just know that some of that is in lab and path, and it is a slight and a big difference when we're talking total and free. But you can Google, you can find out those differences just like I did. I'm not working any magic here, but it just takes time. All right, immunizations. I said I'd do some more immunizations today, and then we're going to have musculoskeletal if we have time, and more cardiology cath ones too. So, and the flaps for the integumentary. So, immunizations. The first thing you need to do is see if you are doing 71 or 60. This one has everything in the 60s, so we don't have to worry about it. They are getting counseling. Counseling is in there. So now we're going to have to count components. How many vaccines were ordered? MMR, Parenthetical, and influenza. So we've got 3 vaccines. We're going to take one component from each vaccine if we're going to build the 60s, and we're going to times the first digit by 3 because we have 3 ordered and we're taking one component from each. So A goes away. We know that we can't use that answer. MMR has 3 components in it, mumps, measles, rubella. We took one away, leaving 2. How many components does this pentacell have in it? Does anybody know? I do have a list for free on my website at Medical Coding by Jen under the shared gallery. If anybody wants to go there, I have a list of all the vaccines with their proper names listed with their CPT codes so that you could find the CPT code, write the proper name to it, and then also write how many components they have for these particular exam questions. How many components does pentacell have in it? Yep, we've got 5. Sure do. We've got our tetanus, Hibs, all kinds of stuff in here. Hepatitis B, we've got all kinds of components. We've got 5. We're going to take away 1, leaving 4 behind. Leaving 4, leaving 2. And our influenza just has flu in it, so it only has 1. So we take away that 1. And that's what we got left over. That's why the 3's here, because we take away 1 component from each. Then we have what's left over. We have a 4 and a 6. That will be the remaining components that we need to multiply for our 61. If we had given, I don't know, like 90648 with our, let's see, with our 90723 with our MMR, not just our MMR, let's do MMRV. Ooh, yeah. 90710. How many components does the 90648 have in it? Anybody know? We have to do components because the physician counseled the patient. We have the word counseling in our question. And I have another question coming up with this particular example. It'll make it better. But anytime you use the word counseling, you have to bill for each individual component of every vaccine that you gave, you get bonus points for it because you counseled the patient on the risk of getting mumps or not getting mumps based off that vaccine. Measles was also talked about with the patient. You get credit for that. You get credit for rubella. Every tiny little component of each vaccine you get credit for, and that's why we're doing the timeses. So this one would have been definitely B because we would have had 6 left over with 3 for the times. If we were giving something totally different, we're using a different example now, 90648. That is our ACTIB. How many components does it have in it? I know, I'm losing you on the components. It's rough. Okay, let me show you on my website. Hold on just a second. Let me get you a better view here. Let's see. I'm trying. Okay, I'm going to add a video capture. Yep, we're going to do that. I don't know if it's a video. It's not a video capture. No, that was the wrong one. We're doing that. Discard. Discard. And we're going to delete that. Yes. Okay, we're going to add a display capture. That's what I was doing. Yep. And which one am I doing? No, we're going to do window capture. That's what I was doing wrong. All right. There we go. So if you're on my website, medicalcodingbyjen.com, there's my bio. If y'all are using me as a reference, it says right there what I do for my job. And then you also go to the resources tab or social media tab, sorry. And that has my address right here if y'all are using me as a reference. We're going to go to the shared gallery. And you're going to pull up these sheets that Twinkle and I posted in here. They're the pink and the baby blue ones right here. So either one set, whatever. Just click on one. You've got a list of these CPT codes. And then the last column over here has the amount of components each vaccine has in it. So, like, and they also have the names of them. See the Pentacel, Pentacel is the second to the last one right here. It has 5 components in it. You need to go grab these pieces of paper. Go to the CPT code right here on this side. Go write the name brand of the vaccine and then also write how many components it has in your CPT book. This will super help you out. There's 3 pages of these things. Just go do that. That'll help for the exam. So if you are in the, let me get my camera up just a sec. There we go. And I'm doing this one. And I'm going to get rid of that one. Yep. We're in the CPT book. If you're giving immunizations, any vaccines at all, there's administration fees. There's two of them. There's the 904.60 and the 904.71. Simple. Anytime you're giving a vaccine, there are two administration fees. It's to pay for the syringe, the time drawing up the vaccine, the time giving the vaccine, the documentation, like making you an immunization record, and paying for the supervision of the physician to watch the vaccines get done. If your physician counsels you on the vaccines and doesn't just order the vaccines, then you have to use the administration fees of $460 and $461. If you use these, then you have to know how many components are inside each vaccine, so you know how to times these. If your doctor just orders the vaccines and doesn't counsel, which happens with 90% of the vaccine questions on your CPC exam, you're going to use the 71. It just pays for the syringe and the time to do the shot. And you do not have to worry about how many components are inside the vaccine. All that is in here in your guidelines and in your notes, and it tells you right here about the components refer to the antigens in the vaccines. It's right there in this paragraph. It'll explain everything that's in there and how you do the adding and not adding, whatever. It's all right there. I am trying to make it easier for you. So this particular question doesn't even have a listing of which CPT codes. You just have to know, based off the name of the vaccine, which CPT code they gave. MMR is right here at 90707. That's our MMR, and there's 3 components in it. I know that because I went ahead and did it. Sorry, my cats are playing with the toys. That has 3 components in it. In these instructions, it tells you how to separate and how to know which number you times by how many components in these guidelines right there. But I am trying to make it easier for you. What I like to do is either just subtract 1 component from each vaccine that's ordered, or you can always say also how many shots were ordered, right? How many shots were ordered? There was an MMR, Pentacell, and a flu. 3 shots. So we always know our first number is going to be times 3 if there was 3 shots given. We know that MMR has 3 components. This one has 5. This one has 1. If we add all those together, we get 5, 6, 7, 8, 9. We get 9 components in all the vaccines. We minus 3 because we already put 3 components in the first 60. That leaves us 5 left over, or no, 6 left over, sorry. And that's how we know how many components to do the back side. Most of the vaccine questions on the CPC exam don't have you adding components. Our lucky little exam C, one of our most hardest exams, might have these components in it that you need to know. It's just 1 question. You've got 99 other ones. If this is too complex, don't worry about it. But I can show you at least some steps that you will help you to know which answers are right and which answers are wrong. If you have a 60 that's by itself without a times, but then you have a 61 that does have a times, you know this is a coding irregularity. They do have to be divided up like these guys are. You will not see something like that. And if you have more than 1 vaccine, you're going to have the 61. So if you can tell that you have 3 vaccines, you know you're going to have the 60 and you know you're going to have the 61. So you can get rid of D too. Now, just figuring up what the answer is, your component answer should equal up to how many components you have, which is 9 altogether. 9 plus 3 is 12, but 6 plus 3 equals 9. 9. I don't know why I'm drawing a 3. I'm being dyslexic right now. Let me get rid of this. Oh, wrong one. Is that it? Nope. I need to get rid of that. What did I get rid of? Okay. Okay. If we had a different question, and I'm just asking separately from these, if we had codes 90648 given, how many components does that one have in it? It has 1 influenza, it's a Hib, right? Our 90723, and some of these are all out of sequence because they're all out of whack. So they're all hard to find. But our 90723 is on page 730. And our ACT Hib, our 90648, is on page 728. This one has 5 components. And then our MMR with varicella is our 90710, which is our ProQuad, which has 4 components in it. So altogether, we have 10 components. So you know your 60 code, the 90460, we have 3 vaccines, is always going to be times 3. And then our 90461 will be the remaining, right? It'll be 7. But just be sure and go to my website, get a copy of all those little pink and blue sheets, go to each CPT code, write down the components, or get a copy of my medicine section of notes where I've written out every little thing you could possibly want and more for your CPC exam in my notes, and you can download the CPT book page by page and just copy the notes if you wanted to. But this particular answer is B. And then this one, if we did it on the fly, would have been 60 times 3 and then 61 times 7. But I do have another vaccine question coming up. And you can see you've got the administration fees of the 471, the 460. We've got another 460. And then we have one answer where there's no 60, but there is a 61. Would there be a 60 without a 61? Or, I mean, a 61 without a 60? I don't think so. I've not seen it. So I bet that's a coding irregularity there. Don't know. Could be. Could be right. Oh, that's not even an 04. Is that an 04? Anyway, if we're doing the 471, there's only one answer with that. So let's look for the word counseling here to see if the doctor did counseling or not. Did the doctor do counseling? You just count the vaccine components and then you count the components, then you count. Good night, Jen. See you later. This is a brain buster. Y'all are so funny. What does this say right here? What does it say the MD said? MD speaks with the child's father about the national immunization recommendations and the risk and benefits of the vaccines provided. That is AKA counseling. So they did counsel the patient. So we're going to have to get rid of our 71. What was ordered? We did DTAP. How many components are in DTAP? We definitely would not do the 60 with the 61 with the 61. That just looks crazy. I don't like C. And then we don't do a 213. If we did anything, it would be a wellness exam, and we wouldn't have 2 Z codes. None of this makes any sense. All of it looks irregular. A is the only one that has anything in it. 90461. It says each additional vaccine or a toxoid component administered. Our TDAP is just a tetanus toxoid. That's why they used the 61 without the 60, is because it was the only vaccine that was ordered was a toxoid. So A is your answer, and everything else is a coding irregularity. You wouldn't do this, 261s. You can't do the 71 because they canceled. And this one's got 2 Z's in it, which you wouldn't have unless the kid had an absent organ or something, which is totally weird. I've got another one. So looking at this one, we have, there's our 71. We also have office visits. And then whatever this 378 is. What was given was a monthly injection for RSV called we used to call this Synvisc. I don't know why it's spelt with a G, but we always called it Synvisc. It come in a pre-filled syringe pack with super expensive. It was like thousands of dollars per vaccine. Not really a vaccine. It's immunization. It's a immunosuppressant. It's to help you build up your immunities when you don't have any immunities. So technically, knowing that this is not a vaccine helps out, because if you are here, I'm trying to bring it up. Come on, mousy. Work, work, work for me. Nope. Go in there. And, yep. If you're under immunizations, you're given the 60 or 71. Since Synvisc is not a immunization, it's to build up your immune system what does our guidelines say we have to use when we're giving out stuff to give to build up somebody's immunity? It says we have to use the administration codes of 96365 through 96375, right there in your guidelines. So you have to know that Synvisc is for immunity and that it's not a vaccine. So we would not use our 471. We can get rid of that. And we need to find an answer that has a 963 number in it. Like this one. This one doesn't have it in it, so we would get rid of that one. This one has a 963. So now it's a difference between that one and that one. Our 90378, which is right here, which is for the respiratory. It's 50 milligrams. What was ordered was 40. It's in both answers. It's saying that we gave the 72, which is listed in our orders. You just need to know, would we do an office visit with it? Does it say there is a MD visit or just the nurse visit? This is just the nurse documenting that she gave the shot. So there would be no need in adding the 992. So that makes it clear that our answer would be our D. If you go back in the back of the book and look at what the 96372 is, it's just an administration of an injection. It could be sub-Q, IM. It's back there with the infusions and IV treatments, but it's also listed in your guidelines right there where that immunoglobulin is at. Be sure that you write down the AKA term of the Synvisc shot up here near this medicine section, and also write it near the 90378 CPT code as an AKA term. So if you see it on any exams, you'll know that that's not a vaccine, that that's an antibody. It's to help build up their immunity, and that'll help you out. And remember, of course, to underline that sentence in those guidelines, it says you're supposed to use the 96365 through the 96372. Some antibodies you can give by IV, but this one was just given sub-Q or IM. What was ordered? IM, intramuscular. There's not a lot of muscle on them premature babies. That's always the roughest. Where am I going to find a muscle at? They don't have much. All right, ICD-10. Where are you going to find the definitions for the 7th digit? One thing that's super handy dandy to know for the exam is to know that we do not go all the way down to the individual digits here. You need to stop at the first 3. So if we go to S82, and you stop at just S82, you will find a list, a huge list of all the little 7th character digits for everything that is going to be a 7th digit for your S82. You won't find it if you go down to S82.4000. There won't be a seventh character listed anywhere near here. You won't find them. You have to stop and find those seventh character at the first 3 digits. So, knowing whether we're an A or a G has to happen here. Initial encounter for a closed fracture, or are we doing a subsequent encounter for a closed fracture for a delayed healing? Do we see anything in here about delayed healing? Nope. Then that means we can get rid of C super fast. It's a lot easier, right? Get rid of the G. That helps out. We still have an S82-4 or an S89 or an M84 on this one. But we've eliminated one. Is a stress fracture usually closed? Are we even in the right area? S82-4. S82-04 is unspecified. S89. That is a fracture, which is not a stress fracture. Unspecified. That one's not a stress fracture. Thank you for the follow, Jen. Thank you for the donuts, Heather. You're awesome. I'm so glad it's helpful, Bailey. A, B, C, D. I'm not finding anything that reminds me of what a stress fracture is. Let's go look at our little outlier M84. M84.3. 364. We found our stress fractures. That's a good one. Not going to be anywhere near your S82s. Going to be back here at the M's. Thank you for the tappy taps. 4,000 likes. That's awesome. Let's see. Oh, closed treatment. Yep. We've got 3 of them that are in the 77s. The 2 that are the closest is the 60 and 62. I'd probably go there first. See what those differences are before I worried about my other codes, because I like looking for similarities. So 277. Before we worry about our question, don't be reading it. Go see what your differences are on your codes first. It'll save you time. 277.60. That's the closed. $62 includes manipulation. We have a tibia shaft fracture with manipulation, and it is closed. I go through the entire CPT book. In any procedure that says it's closed, I circle it in orange, the word closed, and then any procedures that says it's open, I circle in green. That just gives me a great look at the book so that when I'm going through looking for the correct answer, I have a super fast way of picking out which ones are which. Super helpful. If I'm only looking for the green ones, then I know I'm avoiding anything in orange. Just not even worrying about it. Super helpful. What do you guys think is the answer in this one? Oh, Kathy, I'm sorry. Am I keeping you up late? Don't worry. You can watch the replay tomorrow. It'll be there. Yep. It's not even. None of these have been our similarities tonight. All these answers have been something that isn't close to my similarities. So sometimes that happens. Usually not so often. You'll find it maybe 5% of the time on the exam, but tonight I put together quite a few of them that are not our similarities, just to make sure that you realize that that may happen from time to time, but it's really not that often. This is our 52, which is sort of an outlier. It's not completely out of the realm like our 78 would have been, but it is a little different. This is something I made for you guys that you can screenshot. Let me see if I can't get it all into one for you. This is every different kind of skin flap all in one, cut down into super small set of words so that, because there's definitions all over the place, and I just wanted to make it super small and to the point. What is exactly each kind of flap? But this is just a one-sheeter. It's part of the integumentary and musculoskeletal things that I have, study guide that I'm making for you guys. I'm almost done with it, but it's going to have definitions pared down like this, and then tons of coding examples and what the code answer would be for each kind of situation. But this is just one page from that document I'm working on right now that I thought would be helpful for you guys. Because a lot of people don't know that a composite graft is also called a skin flap, you know? So these are all skin flaps. So I thought that would be helpful. And we can look at this next question. What have I told you guys is our 14s? When our second and third digit is 14, what does that mean in integumentary? And knowing this will save you so much time on the exam. What's our 14? Our second and third digits. What does that mean? Good night. No worries. You're very welcome. See you later. Fourteens equal benign, and 16s, when you see second and third digit is 16, that is malignant, right? And then when you see 14 as the first and second digit, you know it's an adjacent tissue transfer, an ATT. So just knowing this, not even worrying about what comes next, but just knowing this little bit of information in your head, even if you have to write it at the top of every page on your integumentary section, benign equals 114, benign equals 114, and then malignant equals 116, 116, and then ATT equals 140. That's super helpful knowledge because you can check this question real quick and we see that we did a malignant neoplasm, and you know right away what your answer is not going to be, right? We're going to get rid of anything that's benign, and now we're down to a 50-50 shot. That's super helpful, beyond helpful. What did we do? We did a Z-plasty repair. Would that repair be 3 CPT codes, or would it be 1 CPT code? More often than not, in our exams, they want to make sure that we're not overcoding, right? But they're going to try to push us into overcoding. So if it's just a difference between coding one thing or 3 things, unless you see like, I did a punch biopsy, and then I did an excision, and then I did something totally different, you're not going to bill 3 different things. All they did was removal with a Z-plasty repair. That is an adjacent tissue transfer. And if you look on page 93 of your CPT book, we've got adjacent tissue transfers, the guidelines here, and right inside there where the yellow is, it says Z-plasty, Y-plasty, V and Y-plasty, rotation flap, island flap, advancement flap. Those are all called ATTs. So anytime you see one of those, you know you're going to code what's on the next page, which is your 140 codes. These are all 140s. So this one, we know our answer is D. I didn't get to everything. I've got, where am I at? I only have 3 more questions. I'll do those on Friday, and we'll do some more questions. For those that are still awake, anything that you guys want to see, probably more vaccines, right? That I can do. Anything else y'all would like to see? Anybody on TikTok or on YouTube? Is there anything that you guys would like to see? Yes. Z-plasties, Y-plasties, V-plasties, those rotational flaps, the island flaps, those are all adjacent tissue transfer, not just the Z-plasties. There's a whole list there. So be sure and grab those from your CPT book. Yes, my notes are pretty cool. I'm proud of them, but they've taken 3 years to make by listening to you guys. Tell me what's on your exam when you do take them, what you wish you had known, asking for more information I have to gather that from you guys, and then I have to adjust my notes based on what you guys say. So you guys have helped me make these notes. Absolutely. Learning how to code the coding irregularities. More irregularities. All right. Coding irregularities. I can do that. Absolutely. Vaccines for show. Hydration. Okay. Hydration with chemotherapy. Hydration with dialysis. Those are always tricky things. Jess, thanks for having your subscription on TikTok. You're welcome, Melissa. ICD-10, more of those. Lab and path questions. It was a 87 or an 82 guideline. I haven't been able to find it. I had a lab and path question with an 87 or an 82 guideline. What in the world? The guideline was cited from 1980? Is that the CLIA waiver? The CLIA? I wonder if it's something from the 80s. Oh, just... Lab and Path. Accreditation standard. I bet it's the CLIA waiver. There's a 1992. Yeah. Accreditation. I'll have to keep looking, but I bet it's the CLIA waiver. It began with 87 or 82. Oh, the CPT code number? Okay, sorry. Okay, I'll keep looking. Anesthesia. Love anesthesia. We only have 4 questions on the certification exam with AAPC for anesthesia. So it's not as many as some of the other sections, but there are certain things that I know we need to know for the exam for sure. Absolutely. All right, guys. I will see you guys on Friday. I hope this was super helpful. I know it was super advanced. I have an advanced class coming on Friday if anybody wants to participate. I still have 20 spots open. It's $5. It's 2 hours of class. It is 50 questions we'll do in the same pace as the exam, and they're going to be advanced questions. And no one gets access to those replays for the first 30 days, and then the replays are available for the first tier members on YouTube. But the replay is available for anybody who purchased that class for 30 days on YouTube. So I hope to see you guys in there. It's always a fun morning, and we'll go over a ton more questions. Don't forget about the workshop that's going to happen on the 20th. It's on Sunday. That's at 2 o'clock in the afternoon on Sunday. It's 3 hours. We're going to go over 75 questions, and we're going to do 3 questions from all 17 sections of the CPT book, certification, and it is $12 if you want the replay. And the replay is only available for those who pre-purchase for 90 days. And then after 90 days, it goes to the YouTube memberships. So I hope to see you guys there. Good night. So Friday is 8:30 Arizona time zone in the morning. And then we do a 6:30 in the afternoon free live for everybody for 2 hours. You are very welcome, Lisa. Thank you so much. Thanks, Leno, for adding to the Discord group. I hope that's super helpful. Thank you, Twinkle. All right, guys. It was a guideline question, and it was started out with 87 or 82, and it was a guideline question. All right. I'll see what I can find for you. All right. Love you guys a ton. Cardio, more cardio questions. Anne wants more cardio. I do have one coming up. And 2 more integumentary. All right, guys. I will see you a ton on Fridays. I hope